Sure. Just give me a second.
Hello, good morning, everyone, and welcome back to another podcast. And today I have a very smart individual. She is a young doctor based in Sydney, and she recently got a job. And we'll just crack on with her story. I think you guys will really enjoy it. It's a really inspirational story. So we've got Dr. Lima Adams over here. Welcome, Lima. Thank you for joining us on today.
No worries. No worries. Thank you very much.
So, Lima, tell us a little bit about yourself, a little bit of a background.
Yeah, I basically am from India and I have graduated in 2017. And following that, I worked, I finished my internship by 2017 and worked in India for 1 year. After that, I reached Sydney. I was married like here and I reached Sydney by 2018. And basically, I was not knowing what was happening in Sydney when I came over here. I had no idea regarding like we had to pass on to exams, we had pathways to get into and things. So I came over to Sydney knowing nothing. Then after coming to Sydney, I slowly started digging into what is happening, what are the pathways we can get into job. And we all know everybody would have studied like everybody studied medicine, and we took like a part of our life to finish off that course. And coming over to Sydney and having no job is a very, very hard time. And to crack this one, the pathways here is like one is like the standard pathway. We need to write one of the difficult exams in the world, that is like the AMC clinical exams, clinicals as well as the MCQ exam, not only 1-2 exams. And I was like mostly from my perspective, I was married here, and most of the ladies I think like will be married to Australia only. And coming over here, they learn, it takes like some time to learn what is happening in Australia. And I learned that we need to clear MCQ exam. Then I studied for the MCQ for like around 6-7 months. And while I was carrying my baby, I like studied for AMC MCQ. And Alhamdulillah, cleared like MCQ. And I thought like that's it. Like MCQ is the one that is one of the difficult exam, and I cleared that one in the FSQ. And like I thought like, yeah, that's it, I'm going to get the job. And I didn't know anything. I applied everywhere. I started applications, like I modified my CVs and my everything, whatever I can do I have done, but nothing worked. And then I came to know, no, this is not it. Like we need to write a clinical exam, or we need to finish off the English exams. And out of that, I understand English exam is mandatory. I cleared the English exam. I learned that one and like cleared the English exam.
When did you clear your AMC MCQ?
I cleared AMC MCQ in 2018, 2019.
2019.
Yeah.
So as soon as you
2019.
came over here, in about a year, you sorted out your exam.
Yes.
Yeah. All right. So go ahead. Then what happened after clearing the exam?
Yes, after clearing MCQ exam, a little bit of family matters came in by, and my delivery, and it was just complicated and things, and it went by side. So I just took like 4-5 months gap. I didn't know that taking gap was a big issue. It built up gap, and like it is a very important in Australia. We do everything like in one go. Taking time out of that will risk a lot in our career. So I didn't know that one. I learned like after coming here only. Then after that, I cleared MCQ, and suddenly like boom, the COVID came, and I was trapped there, and there was no exams, no clinical exams, and I was trapped there, and I had no choice. But the ultimate goal is like to get job somewhere. So what I did is, then only I found out like you, Dr. Nach, and the thing is that what I was doing was not the right path. I was making CV like, and I was applying for jobs. I was not missing anything, but that was not the right path. So I was fortunate to find out someone like Dr. Nach, because what happens in Australia is entirely different from what we in our country. So somebody who knows things here, we need a guidance for how to do the things. So that guidance was given by Dr. Nach, and like he helped me with like the CV, the CV what I prepared was correct, but it need to be sorted out, and it need to be organized into things that is needed in Australia. not like all our achievements, but whatever specific for Australian Medical Council. So he helped for that one, and also a cover letter. And my cover letter was like 2 big page cover letter, and I didn't know that like it was not to be like 2 big page. He made it into as like, what do you call, just 3-4 paragraphs, that's it. And that was like an impactful cover letter. And also my selection criteria, so lot of modifications, lots and lots of modifications were done on selection criteria, because I thought like we apply for our jobs and they look into our achievements and our credential and give the job. No, they look into our selection criteria, and that the impact that selection criteria gives, that is the thing making us shortlisted. And that was told, that was like I come to know from Dr. Naj, and like he helped me with that selection criteria, and lot of modification was made in that. And finally I applied for jobs with that one. And I was applying for jobs for 2 years, from 2018, 2019 to 2020. I was applying. Within one and a half month, I took like a mentoringship class from Dr. Naj. I got like 2 interview calls, one from Sunshine Coast Hospital and other from the Campbelltown. And he also helped me through that interview. He took a session for just practicing the interview, and I cleared in my first interview. I was one of the first preferred candidate for like the hospital, and both of the hospital came back with me for with the offers.
Congratulations! I think most of the work was done by you. Really, you can guide people, but essentially all the legwork was done by you. So just to break it down a little bit, you're applying for jobs, and then obviously you took a bit of mentoring from me. How many jobs would you have applied before? And how many jobs did you apply after catching up with me? And what was the main difference?
Yeah, the main difference was before catching with like you, I was applying for campaigns, like all the campaigns I was applying for. But I don't know, like campaigns are like for all the doctors. But after that, I started applying for all the individual jobs, and all. You also helped me like to call to like the hospital and ask like how the things work in there, and ask for any observationships and like this one. That creates like rapport between us and the hospital. That rapport and to be great. I just applied for the job and waited for like this thing before that. And after that, I learned like we should have a regular follow up with like what we apply and things. And that follow up helped me a lot to get a rapport with the hospital, and they to make a connection with the hospital. That was the difference. And like before that, I was applying for I totally would have applied for say 50-60 jobs. And after that, I applied for around 325 jobs a month, just a month after that one. And totally, yeah, in 1.5 months, I would have applied nearly like 300-400 jobs. And like I got like calls from some.
Yeah, so you really ramped up your job, applying for the number of jobs you're applying, but you also ramped up the fact that you're calling them and developing rapport.
Yes.
And
Yes.
given you had a bit of a gap, how did you manage to convince the hospital about that gap?
Yes. So basically the gap was convinced by the CPT courses that I have done, in regards to this one. And I basically explained myself working like to as some paid jobs somewhere, like basically looking for a paid job, and some teaching, research, telehealth, like all this were mixed up, and I maintained like to fill that gap with that.
Did you do any telehealth in India?
Yes, I have done telehealth in India. I did like on the 2 waves of COVID which was very demanding for Indian society. So during that time, I have done like during these 2 COVID times, I have practiced telehealth in that one.
Brilliant. So just to tell the viewers about this, that's a really good move. So if you do telehealth, then you're basically working as a doctor but remotely, and then you're paid for it as well. And then obviously that's looked as legitimate experience of recency, and hospitals and opera does really like it. So now you've secured a job in one of the bigger hospitals in Sydney. Tell us a little bit about the process from the time you get a job offer to getting the registration, and how long does it take?
Yeah, that is basically from the time we have finished up the interview, it is like a long waiting. They need to shortlist, they send the references, they ask for this one. Every week I used to call them and ask, is there any progress with my application? Is there any progress with my application? So basically the interview was on June and I got the offer by August first week. August first week I got the offer. It was almost 2 months for the offer to come in, and I have applied on August for like registration. It's like now September, still it hasn't like come through. And I contacted them last week also. They told like it is still waiting for a case officer to get assigned. Hopefully like in few weeks it might come through.
Look, that's brilliant. Look, hopefully that'll come through. From experience, I know that it can take up to 3 months. So, but it's a matter of following up again, as you did with the hospital, calling them again and again, emailing them again and again, and telling them that this is urgent.
Yes.
I think that's the best way to go about it. Now, for new candidates who have cleared part 1 and have done English, would you recommend them applying for jobs or doing the clinical exam?
Yes, definitely. I would recommend applying for jobs because I have done my clinical exam twice. I always go out in the category of approach to the patient. I don't think like we get an experience to approach to patients unless we know what is Australian system and how it works. So I always recommend like to go to the job, study the system, and even if we don't study for the exam, the chances of clearing the exams are more after starting the job. So that will be the perfect time like to apply.
Would you recommend certain areas of Australia or hospitals in Australia where new candidates should focus their attention on in terms of hospital jobs?
Yes, I would recommend more towards like rural areas, like to remote areas. Rather than like recommending different areas, I recommend more follow-ups. Like more frequent follow-ups with the hospital, same hospital. Obviously, metro areas are very difficult to get. Like they will be having very rush to. A lot of candidates will be applying for like the metro areas. Those who are working in remote area also will apply for the metro areas. So the chances of getting more will be in rural areas, especially with to the outskirts, but countrysides. But it depends on like how good we follow up.
Did you use any strategy or a specific method where you would write down things and follow up? How would you remember following up with the hospitals?
Yes, that was also introduced, like that was also shown by you. I used an Excel sheet in which it is clear. I clearly wrote like which is the name of the hospital, what was the first contact person, what is the contact number, what was the first response, what was the date of date we contacted, and what was the further response. And it is according to what Dr. Nash like has shown. He has shown his way of follow when he came over here, and I followed the same methodology in that one. I filled up each hospitals in the Excel sheet and followed up according to that one, and even wrote the responses that they gave.
Yeah, and obviously once you do that, you've got a bit of a structure and you don't forget things, and then you're following up regularly, and that's the right way to go about things. Now, before going, thank you very much for your time. We highly appreciate that your motivation for newer people coming in. People like yourself have shown that if you work hard and you work strategically, you are able to get a job after part 1. So we wish you all the best for your future. And thank you very much for giving us your time.
Thank you very much. No worries.